Well, welcome, 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 everybody. I am so glad you are here to join us tonight and to hear what the doctor has to say about autoimmune issues. And is there any hope? Is there any hope? Is there anything naturally that you can do to make yourself feel better? Well, guess what? I believe there is, because guess what? We're helping a lot of people 10 drops at a time. So, thank you so much for coming in. If you've got a friend who's dealing with autoimmune issues, why don't you do me a favor? Send them a text right now and invite them to come on with us and to join us and to learn about this amazing product and this technology and all that the doctor has to share. So I'm not going to talk no more because I've already got myself in trouble tonight. Thankfully, it wasn't all on recording. So that was close. But Dr. Jeremy, thank you so much for taking time out of your schedule to come and share with us about what you know about autoimmune issues, what we can do to help ourselves. And you take it away.
Thank you, Anna. Welcome, guys. Some good-looking people on tonight. My name is Dr. Jeremy Thornton. I'm an internist. I'm a chiropractic physician and a clinical nutritionist out of Missouri. I primarily work with autoimmune disease, and so this topic is near and dear to my heart. I have a big passion for autoimmune disease. One, because I've seen it affect people that were very close to me and that I loved, and I've seen it devastate people's lives, and I've seen the traditional medical care for autoimmune disease is really sorely lacking. And I know there's some other health professionals on here that would agree with me on that. And there's just not a lot of good help out there. There's not a lot of good information. And not a lot of good care, sadly. So we're going to talk tonight about often overlooked root causes. A lot of times allopathic medicine just kind of treats it as if it just showed up from somewhere, that we have this disease, out of nowhere. And then we take drugs to try to treat the symptoms of that disease without ever asking why. And that's a question I ask all the time, all day long in my practice is why? Where did this come from? There has to be a reason. We just don't get diseases for no reason. And there has to be underlying causes and root causes. And so that's what we focus on. We're going to also talk about my favorite natural solutions for those that might be dealing with autoimmune disease. And I'm also going to share an exciting new technology that is showing a lot of promise and a lot of benefit for those dealing with autoimmune. So if you yourself have autoimmune disease of some kind, would love to know it in the chat. If you would drop that down, maybe what you're dealing with, or maybe you have a loved one that's dealing with autoimmune illness, or somebody close to you, would love to know maybe what they're dealing with or what they're struggling with, just to kind of get a feel for who the audience is and what kind of health conditions that we're seeing. Let me see if I can pull up my screen here real quick. All right. All right, can you all see my screen? Awesome.
Yes, it looks great.
Let me move some things around on my screen here. All right. And first thing I want to just talk about is that the information here is educational. It's not designed to replace professional medical advice. It's not meant to replace your physician's advice, but it is for your information. If you have an autoimmune condition, of course, work with your physician, your health professional. So that's my disclaimer, right? So these are 18 of the most common autoimmune diseases right here. MS, we have type 1 diabetes, right? That's most people think just diabetes is lifestyle, and type 2 is. Type 1 is an autoimmune disease where the immune system attacks the pancreas. We have celiac disease, right? That's a gluten intolerance. We have Addison's disease, affects the adrenal glands. Guillain-Barré, I can never pronounce that one right. Myasthenia gravis, those are neurological conditions, autoimmune diseases. And we have inflammatory bowel diseases like Crohn's and ulcerative colitis. Graves and Hashimoto's attack the thyroid. Vitiligo attacks the melanin producing skin cells. We have lupus, which can affect lots of different soft tissues. We have Sjogren's, psoriasis, rheumatoid arthritis. So those are some more common ones. Let me see if I pulled up in the chat. Anybody share? Celiac. We have celiac in the house, scleroderma, with Jan's husband. We have RA, possible fibromyalgia. Yes, very common autoimmune connections with that as well. So there's been at least 100 or more separate autoimmune diseases. That just seems overwhelming amount of different separate autoimmune disease or different conditions, but that's how many have been identified thus far. 50 million Americans currently are dealing with autoimmune disease. That's pretty staggering in and of itself. And the other scary part is that about 25% of people that have an autoimmune condition will go on to develop another autoimmune disease. And again, because generally standard medical care is not addressing root causes or underlying causes, right? We might be suppressing symptoms. We might be doing things to target inflammation or to downregulate the immune system in cases, but we're not getting to the root cause. And so that overwhelming upregulation of the immune system can eventually have the immune system attacking something else, right? So I have a lot of patients that I see that maybe they started with Hashimoto's, right, attacked their thyroid. And then they went on to develop lupus, or then they went on to develop RA, rheumatoid arthritis, or maybe they went on to develop multiple sclerosis. The immune system can just continue to go, just go rogue and start attacking things. And it's not good when it's attacking us, right? So this is a graph showing the balance of the sexes. Unfortunately, women, this is not good for you. Autoimmune disease overwhelmingly is seen in females. So the red lines here are the female prevalence, and the blue spots here are the men. So Sjogren's and Hashimoto's and lupus and RA, MS, celiac, predominantly female. Okay, as we get down here to Crohn's and type 1 diabetes, about 50-50. Ankylosing spondylitis is primarily men. And that's believed to be due to the role of estrogen, right? Something that women were blessed with is sometimes an abundance of estrogen, sometimes starting at a very young age. And the longer that cells are exposed to estrogen can be problematic and very inflammatory in nature. So the thing that I often hear is, well, my mom also had RA, or my mom also had Hashimoto's, or my grandma, right? So it's almost as people expect if somebody in their family had it, that they're just going to have it. And that's not at all true. So if you have that school of thought, I encourage you to think differently, because even though we might have a genetic predisposition towards a certain condition, does not mean that's going to go on to develop into that disease process. And there's lots of things we can do to prevent that from ever happening. So I love the saying that genetics might load the gun, but it's lifestyle. It's always lifestyle that pulls the trigger. And so if we can get tunnel visioned in on the lifestyle choices that are going to make a difference in our immune system, make a difference in our toxicity load of our body, make a difference in the inflammatory load of our body, we're going to impact those genes expressing that potential health condition or potential disease process. Let me move things around here on my desktop real quick. So I often talk about triggers or root causes. I like to use that term a lot. And so these are some of the more common root causes that can lead us down the autoimmune pathway. So one thing I see an awful lot of, and I know Sherry would agree with me, is leaky gut. This is very common, and in fact, we do one whole night on leaky gut, right, Anna? We have a whole segment just on leaky gut and how it impacts our health. And but 80% of our immune system or more is in our gut. So if we have an unhealthy gut, we have an imbalance of good guys to bad guys in our gut, or yeast or parasites or unfriendly bacteria. And then, of course, our lifestyle trashes our gut, from non-steroidal anti-inflammatory drugs and steroids and aspirin and all the the antibiotics that we're given over our lifetime, and then just the toxic environment that we live in these days with the fluoride and the chlorine, and goodness, don't even get me started on all that. We could talk all night just about those types of things. But the gut has a lot of wear and tear, right? And then so now we're just doing our typical diet, and then some of these foods that we're eating start escaping through that leaky gut. That's where they get the term leaky, right? Escaping through that leaky gut into the bloodstream where our immune system is, right? And so we get across here, we start to develop food sensitivities. The immune system starts to label some of those foods as bad guys. And once the immune system decides that food is evil, it doesn't try to figure it out anymore, right? It's convinced. It puts up the wanted posters, the kill on sight. So every time you eat that food, it's creating an immune response. And that immune response can turn around and start to create what they call molecular mimicry, where the food or the immune system might start getting ticked off at that gluten in your diet, right? And then the immune system says, you know what, that gluten that I don't like kind of looks like that protein in her thyroid gland. Maybe that thyroid is a bad guy too, and then now the immune system is ticked off at the thyroid. Now we've got Hashimoto's or we've got Graves', which all may have started from leaky gut that developed into food sensitivities. We can have nutrient deficiencies. Some of the biggies are things like magnesium and vitamin D and omega-3s, antioxidants like glutathione, deficiencies that can set us up for immune system dysregulation. Insulin surges. Everybody you see these days is carrying a Route 44 soda everywhere they go, right? I went to, Sarah and I were at a convenience store, and I saw this little kid came out holding a bucket. It was kind of like this. It looked like a bucket compared to his size, right? And he carried this out, and I was thinking to myself, what in the world was he carrying out of there? And I get inside, and there's this whole stack of 96-ounce barrels with a handle on it that they had a special price on, that you could fill it up for $1. And this kid was drinking a 96-ounce barrel of soda. Our whole American lifestyle is driven by processed foods and sugars and high fructose corn syrup, and all of these things that drive an insulin surge in our body. And insulin is very inflammatory. Insulin is also what I call the hibernation hormone. If we're driving a lot of insulin likes to grab everything and hold on to it, right? Like it's tucking it away for winter. So it holds on to fat and tucks it away. Sometimes it puts it in places we don't need it, like in our liver. And all of that, of course, is driven by diet, by sugar in our diet. Chronic infections. I see this a lot in autoimmune disease. There can be underlying, sometimes hidden infections that are driving the immune system and keeping it stirred up like a hornet's nest, right? So I see things like Epstein-Barr virus. I see things like H. pylori, which is the bacteria known to cause ulcers in the stomach lining. I see parasitic illnesses. I see yeast problems in the gut, right? And the chronic infections that are driving the immune system to be, ticked off as it's fighting that infection can turn the corner and actually start attacking us. We talked a little bit about this with females, is estrogen dominance, and men have this as well, especially men that have a larger belly. The excess fat that we carry in our abdomen I call it an estrogen factory, is often producing estrogen. I see this in my patients as men having estrogen dominance. Of course, females can as well. And sometimes in females, it's just a lack of progesterone, not really too much estrogen that's causing that. Adrenal fatigue. So our adrenals are often thought of as our stress coping glands. And then we have, external stresses, gas prices, the last 2 years of all this ridiculousness we've dealt with, all of that kind of stress. But then we have internal stresses, some of the things we've already talked about: nutritional deficiencies, chronic infections. Stress causes a weakness in the adrenal glands, and that can create a myriad of health effects, downstream from that. Toxins and chemicals. We just live in a very toxic chemical soup, between the water we drink and the air we breathe, and the chemicals and the pesticides and the plastics and the xenobiotics that we're in contact with every day, that takes its toll on our body. And then mental and emotional, of course. We've seen a lot of that, especially with the pandemic and the increases in depression and anxiety. But all this is addressing the root cause, right? This is the things that aren't looked at in allopathic or traditional medicine and generally aren't talked about, but can be the cause or the trigger to start this autoimmune cascade. Some dietary strategies, some things that you can do with your diet to maybe calm the immune system or start to turn things around. And let me move my screen around just a little bit again. So the autoimmune protocol is a popular diet in autoimmune circles, and in a lot of people it works really, really well. They're avoiding those nightshades, which in a lot of people create inflammation. They're avoiding gluten, which in nearly everybody that has autoimmune disease has a problem with gluten, and many of us that don't have autoimmune have a problem with gluten too. But certainly autoimmune disease has a big tendency to have gluten as an underlying trigger. Avoiding beans and peas and rice and wheat, sugar, of course, dairy, including organ meats and vegetables and seafood and leafy greens, of course, and healthy fats and things like that. So that would be an autoimmune protocol diet. And by a lot of people, by following this type of a diet, and you can just Google autoimmune protocol and have tons of just free information about this protocol online. But the autoimmune protocol tends to calm the immune system in a lot of people. And if we can calm down that overactive, sometimes they call it an upregulated immune system, we can keep that immune system from attacking you as much as it once did. There's also an autoimmune keto diet, and I use this personally a lot with my patients. And it's not your typical keto diet, which would be, just lots of dairy and eggs and cheese and, and meats and and be very low carb. So it's very low carb, but we also eliminate dairy and eggs and nuts, tomatoes and peppers. Again, those are nightshades, not because those are inherently evil, but they are often immune triggers. They are often food sensitivities. And so it's kind of like a traditional keto diet, but we just take out the dairy and the eggs and the nuts. And that's basically what an autoimmune keto diet would look like. Trying to focus on grain-fed, not grain-fed, definitely not grain-fed, but pasture-raised meats. And let me see here. All right, and another way to look is not really a diet per se, but looking at food sensitivities. We talked about leaky gut. This is a lab that I use a lot of the time, or a lot with our patients with autoimmune disease. And this particular panel looked at 184 different foods with this patient's blood, and we're able to tell which foods this patient's immune system was ticked off at. So the foods in red on this screen here are the foods that their immune system did not like and was an immune system trigger. So we had typical ones like gluten, right? That wasn't a big surprise, and wheat. Eggs were also a big one here, but we also had things like radishes and mushrooms, coconut, artichoke, pineapple. Those are not common ones, right? And if we had not have done this test, we would not have known that some of those foods were stimulating the immune system in an unhealthy way. So what we would typically do would be, for a period of time, we would avoid these foods, or we take these foods out of the diet, work on healing the leaky gut, right? And then a lot of times we can reintroduce those foods again at some point. Again, guys, if you think of any questions, drop them in.
Sherry asked a question here.
Yeah.
That she had an IgD test yesterday. Should have she gotten the one that you just showed?
It was probably, Sherry, it's probably IgA, IgG tests, not IgD. So that's what that one was.
Okay. So she should be good.
Yep, should be good. And the difference is the IgA and the IgG food sensitivities are testing a portion of the immune system that's more of a chronic delayed onset type food sensitivity, not the food sensitivities we would think of that send you to the emergency room because you can't breathe and your throat swells or your tongue swells, right? Or you have hives all over. Those food sensitivities are pretty easy to figure out, right? I had a peanut butter sandwich, now I can't breathe. It was probably either the bread or the peanut butter, right? But these other food sensitivities are a little bit more difficult to figure out because it can be several hours, up to 2 or 3 days before there's an immune response. And if you eat these foods on a regular basis, it would never be obvious that there was a food component or a food trigger. And that's where testing sometimes is helpful to figure those things out. So one of my favorite things to use in the natural realm for autoimmune disease is turmeric or curcumin. And I'm going to show you exactly why that is. Show you some of the studies, curcumin, autoimmune and inflammatory diseases going beyond conventional therapy. So in this paper here, they said that curcumin has been gaining ground in the treatment of autoimmune and inflammatory diseases due to the wide range of bioactive compounds capable of exerting substantial anti-inflammatory and antioxidant actions. The effect can be associated with improvement of symptoms and induction of remission in inflammatory bowel disease patients, reduction of erythema and induration of lesions in psoriasis, and slow down the disease progression in patients with sclerosis. Curcumin and autoimmune disease. Recent studies have shown that curcumin ameliorates multiple sclerosis, rheumatoid arthritis, psoriasis, and inflammatory bowel disease. Curcumin inhibits these autoimmune diseases by regulating inflammatory cytokines, such as, blah, blah, blah. Who cares about all those names? Polymerized nanocurcumin attenuates neurological symptoms. So this is an animal model where they created basically MS in an animal model, multiple sclerosis, right, which impacts the brain, the nervous system. And they were showing that curcumin helped by downregulating the inflammatory and oxidative processes and enhanced neuroprotection and myelin repair. So myelin, or the myelin sheath, is the protective fatty layer that coats the nerves, right, and protects those nerve endings, which often get damaged by the immune system in the condition multiple sclerosis, which creates all of the neurological symptoms. So in this study, they saw a significant decrease in the amounts of demyelination. So there was less removal of that myelin sheath, less inflammation, and less blood-brain barrier breakdown. So we do another talk just about the brain that talks about the importance of this blood-brain barrier. But that blood-brain barrier gets broken down in MS, and then our brain is more susceptible to damage from other things, exposures and things like that. Decreased oxidative stress, improved remyelination. So the nerve endings were actually remyelinating, getting that myelin sheath back due to the treatment with the curcumin. This was a test on rheumatoid arthritis that basically showed that curcumin outperformed diclofenac, which is a prescription anti-inflammatory drug, in these rheumatoid arthritis patients. Curcumin just outdid it, which was really exciting. Curcumin, a natural modulator of immune cells in systemic lupus. So in these lupus patients, clinical trials have revealed immunomodulatory properties of curcumin that arise from its effects on immune cells and mediators involved in the immune response, such as various T lymphocytes and dendritic cells, as well as the different inflammatory cytokines. So that was in lupus. All right. And so we're probably thinking, well, if curcumin does such a great job with autoimmune disease, why don't we hear more about it, right? Why isn't it being used more as a standard treatment? And we're going to talk exactly why that is. We're also going to talk why about several of those studies were either in animal models or they were in lab studies, not necessarily in human studies. And the reason is there's a dark secret. We call it the hidden secret, or sometimes was it last weekend we called it the ugly secret of curcumin, is that it's poorly bioavailable. Is that what we called it, Anna? Was the ugly truth about curcumin, wasn't it, that we shared? So what percentage of curcumin that you ingest do you think is absorbed at the intestinal level? I need to fix the slide here a little bit. You'd be surprised that only 10% is absorbed. That's even less if we're talking about whole turmeric, right? Curcumin is a component of turmeric, but if we were taking say 500 milligrams of turmeric, we're going to get less than 1 milligram of curcumin in the blood and the organs. 90 to 93% ends up in the toilet, is what this study shows. In this journal here talks about that the problem of curcumin and its bioavailability, as we read further, it says curcumin has been confirmed to exhibit very poor bioavailability, with many studies showing very low or even undetectable concentrations in the blood and extraintestinal tissues. Major reasons are due to its poor absorption, rapid metabolism, chemical instability, and rapid systemic elimination. So here's the problem, guys. They knew that curcumin could do these amazing things in the lab, in cell cultures, in petri dishes, in animal studies, right, where they injected or otherwise got curcumin into their system. But when they tried to reproduce a lot of these studies in human populations, they started to have struggles. Okay, one of the reasons is that curcumin is a lipid substance. It's an oily, fatty type substance, and we're trying to orally take this, get it through the digestive process, past the liver, into the bloodstream that's mostly water. And we know that oil and water don't mix, right? And then we're going to try to get that into the cells. And so by the time this curcumin was giving orally, and the digestive process didn't do a very good job, the liver chewed up most of it, and the rest of it went, out the urine and the feces. Very little of it ever showed up in the bloodstream. And they were finding that they could not get therapeutic levels of curcumin orally in humans was a big struggle as well. And this is why I mentioned a new technology. So this is what I'm excited about. This is what I'm going to show you with a couple of my patients. And if we have time, hopefully a couple of testimonials about what this can do with curcumin and its bioavailability. We're seeing absorption with this little bottle, this little dropper bottle right here, of up to 277 times greater than traditional turmeric or curcumin preparations. We're going to talk why that is. Got a little visual here. But this is a patented technology that actually came out of Germany. The University of Hohenheim did the original studies on this. And so what they do is they take the red part is the curcumin. They take those curcumin particles and they shrink those down to a nano size, nanoparticles, sometimes they use that term, of less than 30 nanometers. We're going to talk about exactly how small that is. So these very tiny particle sizes are then wrapped or enveloped in a micelle. And what a micelle is it's a carrier that can carry the substance in both oil or water. So this can easily carry it in the bloodstream and easily carry it to our cells, where it can deliver that curcumin, those curcumin nanoparticles into our bloodstream and into our cells. And that's why we're seeing this 277 times greater bioavailability with this new technology. So we start first, of course, this is the turmeric root, right? This is what it looks like. Then we extract just the curcumin component of the turmeric, okay? Then we apply the nanotechnology of shrinking those particle sizes. Then we wrap it in a micelle, and our end result is less than 30 nanometer particle size of delivering this amazing beneficial ingredient, right? This curcumin. So I'll give you just a visual of what size of a less than 30 nanometers looks like. A red blood cell is 7,000 nanometers thick, or wide, I should say. A human hair is 50 to 100,000 nanometers wide. A sheet of paper is 75,000 nanometers thick. A pinhead is 1,000,000 nanometers wide. So 30 nanometers, you can guess is just so small. It's hard to fathom, really. So I'm going to show you just a little bit of what I'm talking about, why scientists weren't super excited about using curcumin orally in humans. So this was a study where they did a 2,000 milligram dose of curcumin. It's a pretty good dose of curcumin, right? Then they measured the bloodstream in hours down here, okay? And drum roll, this was the peak right here. I know, super exciting, right? That curcumin reached in the bloodstream in an hour, right there, okay? And then within 2 hours, look, it was gone. All right, so this is traditional, just regular curcumin in an oral delivery system. Okay, and so you can see why we were getting lackluster results in human studies a lot of the time with oral curcumin. Now, this is what we're doing with this new technology. Okay, what I want you to see is not only the peak. Now, this is the native curcumin is right here, which we can't really even see it getting off the baseline. That's how low, the small that rises, we can't even see it. This is what we're achieving with this nanotechnology, and that's exciting, of course, getting to those levels in the bloodstream. What's more exciting is that, remember, in 2 hours, 3 hours, it was gone. Look at the time frame here: 4 hours, 8 hours, 12 hours, 16 hours, 20 hours, 24 hours later, we still have measurable amounts of curcumin in the bloodstream, which is just unfathomable compared to previous studies. Just never happened, couldn't happen with curcumin or turmeric because of the body clearing it out, breaking it down. It was unstable, and our body rapidly eliminated it. Now, with a single dose, we're seeing therapeutic levels still in the bloodstream 24 hours later, which is simply amazing. I'm going to share with you just a couple of patient results here, and then we'll move on. So this was a patient with Hashimoto's thyroiditis, and what that means is the immune system got confused and thought her thyroid was the bad guy and started attacking it, okay? A lot of times this can create conditions of hyperthyroidism. Sometimes it eventually will create hypothyroidism, low thyroid function, and this is where she was when she started here. These, I won't go into a lot of detail because we can spend all night just explaining these labs, but she had low thyroid function. Look at those arrows pointing down. She had low thyroid function. She had these numbers right here are what they call antibodies. These are the numbers we can look at when they're elevated that tell us the immune system is attacking that tissue, whatever that test might be. In this case, it's the thyroid gland. This number right here ideally should be less than 9. And hers was 620. But you know how aggressively her immune system was attacking her thyroid. These markers down here were inflammation markers. A lot of autoimmune, I would venture all autoimmune diseases have a significant amount of an inflammatory component. Her C-reactive protein was 32. Her SED rate was a 61. So here, all we had done is we did some lifestyle things. We started some thyroid hormone. We retested. We had not started the BioMS technology yet. We were able to improve her thyroid hormone. See this green is optimum here. We were able to improve that, but look, we just wasn't too exciting of her changes here in her antibodies. So her immune system is still ticked off, right? Still attacking her thyroid. Her inflammation markers also, look, they had come down slightly, but certainly not very exciting. So then the only thing different we did between these next two labs is we added this new technology, this BioMS technology. What I want you to focus on is look what her antibody levels did. This is the degree that her immune system is attacking her thyroid. Went from a 579 down to a 47. Her other thyroid antibody went from a 10 to a 1. Also look at her inflammation markers. One inflammation marker went from a 28 to a 3. The other one went from a 53 to a 14. This was in less than 4 months. In fact, her immune system calmed down so much that the thyroid support that we were giving her was suddenly too much, right? We were giving her thyroid to try to make up for how low her thyroid function was, and it did help here, but this caused her immune system to calm down so much, it wasn't attacking her thyroid. Her thyroid started working better, and now we were almost creating a slightly hyperthyroid situation. So we had to back off of the thyroid hormone, right? Because she didn't need that thyroid hormone anymore. So this was one patient with Hashimoto's autoimmune disease. This was a 56-year-old male who had diabetes, high lipids, also had rheumatoid arthritis. I usually share this with my diabetes talk, but we're not doing that tonight. But just to show in this 3-month period, his A1C with just the addition of the BioMS dropped from a 7.4, which is a diabetic range, to a 5.6, which is not only not a diabetic range anymore, it's not even a pre-diabetic range anymore in that time frame. Cholesterol dropped, triglycerides dropped, LDL cholesterol dropped, HDL cholesterol improved. But look at the inflammation markers again. Drop from a 16 to a 6, drop from a 23 to a 5. What's even more exciting is that when we started in November, his rheumatoid factor, which is a measure of rheumatoid arthritis, right? When this number is elevated, this patient, has rheumatoid arthritis. Above 14 is considered positive. He was at an 18 when we started in February. His number was a 12, which is considered normal. So that was super exciting. And it's just a couple of patients that wanted to share their results with you. I think we have maybe 1 or 2 testimonials. I think that's more powerful, of people sharing their experience with their health conditions. Before we switch that, Anna, do we have any questions, or do you have any questions? Or
No, I was looking back through real quick. I don't see any questions in the chat. No, that was very powerful information there that you shared with us. What I love is you explain it in a way that the everyday person can understand what the disease is, what causes it, and what can we do about it. And that is huge, because that empowers people. When people have good knowledge, they can deal with it. So I'm anxious to hear these testimonies tonight.
Awesome. Let's see here. Let me look and see who's on. Carrie, did you make it on?
Yes, there she is.
Awesome.
I literally just got on. That was perfect timing.
Great job.
That was perfect timing.
Could you share just a little bit about your health history and what you've experienced with this curcumin technology?
Yeah, absolutely. Hi, everybody. My name is Carrie. I live in Fort South Carolina. Ryan and Kylie called me about this liquid gold right as soon as we found out about it. And at the time, I didn't know how much I really needed this. Like, I didn't even know what it was. And a couple years ago, I started having issues walking. I work in a restaurant. It's a high volume restaurant. We're busy serving 600 dinners every night in the summertime. It's crazy. It's high paced. And by the end of the night, I could hardly walk. Like, my lower back was killing me. My knee was killing me. And I had some other things going on as well. So I had some, my hands started hurting. I couldn't even make a fist. I had neuropathy in my hands and feet. My fingers would go numb. I would have pins and needles in my feet. And I wasn't getting any answers. So I got the Nanofy, I got the liquid gold in the mail, and I was like, you know what? I'm going to just try it and see. And within 5 days, my neuropathy in my hands and feet were gone. And I started noticing that it was easier for me to walk. So prior to starting Nanofy, I had blood work done, and I requested my doctor test my SED rate, test my ESR, like my CRP levels. I wanted him to check my inflammation markers because I knew something was wrong, and my normal blood work wasn't showing anything. So the first test that I did was my ANA, and it was negative, but my SED rate was 75, and my ESR, or my CRP, was extremely elevated as well. And he said, well, you do have some things going on. And we repeated that blood work, and it was still elevated. But what I will say is, even though it was still elevated, I had been taking the Nanofy for about a month, and my SED rate had gone from 75 to 30. I think it was like 28 to be exact. But I knew that this was working. Like, I wasn't in pain anymore. I wasn't having neuropathy. I could actually walk. And prior to taking this, I worked 2 days to take it just so that my body could rest. And I don't have to do that anymore because I'm able to function. So this has made a huge impact on my life. And I have made it my mission to tell all of my friends about it, especially if they deal with something. Now, fast forward to later, I stopped taking it for probably a good month and a half, 2 months, because I finally got in with a rheumatologist, and I wanted my blood work to like be completely clean and not take any kind of vitamins or supplements. And it turns out that I do have rheumatoid arthritis. So I finally got answers, but now I have a solution.
That's great.
Yeah.
That is so
Super
beautiful.
exciting. Awesome, awesome. I think that's the thing that people notice the quickest is the reduction in inflammation. So that's super exciting. Is Kylie on?
I saw her earlier.
Hello, I am on here.
Hello, hello.
Hi everyone. Hi, Doctor. Amazing presentation again. I take notes every single time. You see this? I take notes. I'm good. Do you want me to just start my story?
Yes, I love your story and would love if you share it with us.
Okay. So hi, I'm Kylie Stokes. I am good friends with Dr. Jeremy. He has been a huge blessing to our life. I'm friends with everybody on here, actually. But my journey, I call it my health journey, started unexpectedly in 2019. I went from, I'm a stay-at-home mom. I am married to a former boys basketball coach, and I am on the go all the time. And in 2019, I went from running 3 to 5 miles a day to being bedridden for a week and not knowing what was going on with my body. My body was shutting down. Something was going on, and I couldn't figure it out. 5 days of being misdiagnosed, bless Dr. J's heart. He tried to help me during that week. He adjusted my ear, which I was like, oh my gosh, it's never hurt that bad before in my life. Like, what is going on? Come to find out, it was nerve pain I was dealing with. So I was just sharing my story earlier today. I found a swollen lymph node under my chin, which within 48 hours had doubled in size. Then that led me to my first trip to the urgent care, because I knew, something is wrong. Those swollen lymph nodes mean something is infected, something's going on in my body. The doctor sent me home with medicine for a possible abscess tooth. I had no tooth pain, nothing. Went home with my medicine, woke up the next day, was still not feeling good. So that's when I called Dr. Jeremy and I said, hey, can you adjust me? Maybe I just need an adjustment. So he adjusted me. By that time, I wasn't feeling super great and felt like my ear was buzzing. And I didn't really feel any pain until he adjusted it. And I was like, okay, something is off. Okay. By Wednesday, I'm feeling worse and go to the doctor or go to the dentist. He was like, your teeth look great. Your gums are a little red, but nothing, I thought I'm worried about. By Thursday, my face was swollen to twice its size. And so I went back to the ER and they sent me home, or they ran a CT scan. By this time, I had extreme pain in my ear and in my head. And she was like, I don't know what's going on with you. Let's run a CT scan. During that CT scan, they ran a CT scan and found a large tumor on my thyroid. And so that was kind of a shock. She said, have you ever had thyroid issues? And I said, no, ma'am, my only primary care physician is my OBGYN. Like, I don't have a primary care. I don't go to the doctor unless I am with child. And so I had that CT scan done. They ran a full panel on my thyroid. Still was in pain. They still had no idea what was wrong with me. They sent me home. The next day I woke up with a full-blown case of shingles on my face, inside my ear, and inside my mouth. 7 hours again in the waiting room, and a doctor who was towards the end of his career came in and said, good news and bad news. Good news, you're not going to die, because I couldn't speak at the time, but that was the only thing I could get out. And he said, you're not going to die, but bad news, this is the worst case of shingles I've ever seen in my entire practice. He said this could take weeks or months to heal. But I don't know if y'all believe in the power of prayer, but Jesus healed me in 48 hours after my diagnosis. But after I was healed, I still dealt with the terrible residual nerve pain. And in June, so that was April of 2019, June of 2019, it was time to address that thyroid issue. Walked into the endocrinologist and he was like, I see it right there. That's got to come out. Before he even looked at anything, did any biopsy. Went in June 18th of 2019 and had what they thought was a plum size nodule on my thyroid. Was actually a baseball sized tumor full of precancerous cells on the right side. On the left side was he said it looked like a large cluster of grapes of nodules. And so there was no choice but to take the entire thyroid. So in 2 months worth of time, my body went from what I thought was healthy, right? What was normal to me to being, okay, now they took the battery pack out of your body, right? 2 weeks after surgery, they then called and did diagnose me with Hashimoto's, which on the phone, the surgeon was like, Kylie, I could have told you that from the day I saw you. So Jeremy and I began research and he began to help me. And man, if you had have you ever seen Elf when he like pushes all the buttons on the elevator and they all light up? So that was me with all the Hashimoto symptoms. I had every single one. And Jeremy and I got to talking and were able to almost pinpoint when my Hashimoto's was triggered. And it was when I was a little girl. I had a intestinal bacterial infection called Shigella, which is like E. coli and Salmonella had a baby. And yeah, 2 weeks in the hospital. So with that being said, I have lived over half of my life with Hashimoto's. And so, you know, for my thyroid to be in that, so whatever I wrote down, genetics loads the gun, lifestyle pulls the trigger, right? Like you said that many times, but it didn't click with me. I really didn't have a choice, right? Until it was too late. So I love that you are teaching to be proactive. So I love that. So with that being said, sorry, I'm a little long-winded because some of the things that you said were like mind-blowing. So for 2.5 years, I lived with all of the symptoms of Hashimoto's. And then you add that they took my battery pack out of my body, which is controls your energy, controls your metabolism, controls your hormones, all of those things. So by last summer of 2021, I was a shell of who I was before my thyroidectomy. My whole life, chronic fatigue was norm. Not sleeping well was my norm. Having dry hair, dry skin, all of those things are my norm. I didn't have trouble losing weight before my thyroidectomy. Now it's a whole beast in itself. But it seemed like all of the symptoms just started to get worse. The fatigue was even worse. The insomnia was even worse. The aches and pains got worse, so much so that I felt like a 90-year-old lady, and I'm only 36. And so as a mama of 3 young, very active kids, I was having to take naps every single day. And that to me was not okay because I'd already lost a whole week of my life, right? A whole week of their life. And so I was tired. After 2.5 years of battling that, I was tired. And so I had been using turmeric, like Dr. J has used it in his practice for a long time. I knew turmeric. I thought I knew turmeric, right? And so our friend and mentor Juan sent us 4 bottles of this, what you guys call our liquid gold. I call it my liquid blessing. And I was like, I don't know. Like, I'm pretty sure that what I'm using is the top of the line. Okay. And so I didn't really take it serious, but I got to a point that I was so miserable and that I had to do something. And so I started using, he said, you can use 10 drops in the morning and 10 drops at night. With your body is as bad as it is, use 10 drops twice a day. And so I used that. And what I didn't tell you is that at the time, I still hadn't gotten my taste and smell back from, what happened, why you lose your taste and smell for over 7 months. Okay. So no taste, no smell, nothing. And so I start my journey and 10 drops a day or 20 drops a day. And within 5 days, I'm drinking a detox tea and realize I can taste this tea that everybody said was horrible. It just tasted like water to me. And so I'm like, oh my gosh, like what's happening? So then Ryan's sitting beside me and I can smell his cologne for the first time. So I'm like, okay, well, something's happening. If this is all it is, at least I got my taste and smell back, right? I'm still a skeptic. I still don't believe in it. I don't know what to expect. Still dealing with that residual nerve pain. So if you've never had nerve pain, it's like a sharp shooting pain that would wake me up. And then I had shingles on my eardrum. So very, very sensitive, very painful. It would wake me up at night. So about 10 days in, I began to feel the nerves in my face. I told Ryan, it feels like my face is crawling. And he was like, what? So if you've ever had surgery and you can feel those nerves regenerating, right? Like that itchy, but you can't scratch it. That's what my face felt like. And I was like, okay, something is happening here. And within my first 30 days, that buzzing, that shooting pain, all of it went completely away. It's still a little numb, but the pain went away. And I told Ryan, I said, if nothing else happens, if it doesn't help any other symptom in my body, that right there is worth $1 million. I'll pay it every single month to keep that away. And so by the end of my 30 days, I had started, I had those two major issues go away. And then I noticed that my body started to not be as stiff in the morning. And then about 6 weeks in, I was sitting by our 12-year-old daughter, and I was like, you know what? Like, I don't know the last time mommy's had to take a nap. And she was like, you know what? You're right. Like I was having to take them, I could go a long period of time, like a week at a time. But I had gone 6 weeks, right? Without being tired, without having to take a nap, and without having to tell them, mom was just too tired for that. And so that was a big deal. And so it was that moment that I was like, I don't know what this is. I don't know why it's working the way it is, why it's different than that powder that I've been using for 2 years, but I have to tell everybody about it. And that's when I sent Jeremy the info, and he ignored me for 2 days, y'all. Ignored me for 2 days. But once I started to tell him what it was doing in my body, he was like, okay. And he'll tell you, I knew how much of a hot mess you were, so I had to take a look. And it's crazy. So I told him just recently, I said, I'm finding out what normal is, like what normal healthy people feel like, right? Like I still have my bad days, but it's crazy to be able to sleep all night long without having to take melatonin, right? And it's amazing to be able to go through my entire day without having to take some type of stimulant. I love coffee, right? But I don't have to have it to wake up in the morning. I just love it. And I don't have to have my tea or whatever in the afternoon to pep me back up, or, a energy boosting vitamin or anything like that. I feel good all the time. And so that's a big deal. What I didn't realize is that I had to target the inflammation in my body for my body to actually heal itself, right? So anyway, sorry, long-winded. You had
love it. I love it.
Awesome.
Kylie's back. Kylie's back now.
Yes. I am. My husband has his wife back, and my kids have the best version of their mommy that they've ever had. So
that's wonderful. That's wonderful.
So exciting. I'll often tell people that as your body starts to get healthy, that we often expect certain things. We expect certain improvements, or we expect certain symptoms to go away, but our body always has its own internal healing priority list, right? And Kylie's body knew that her brain needed healing. What they're finding out with this taste and smell is that's caused by the C word, of course, is caused by neuroinflammation. And she still had residual neuroinflammation, which was causing the loss of her taste and smell. So that first went to work on her brain. Repairing that inflammation in her brain is where she got her sense of taste and smell back first. Then it started to repair the nerve endings in her face, and they went on from there. So that's super cool that your body, that's what your body decided to do first, is it knew your brain needed a reduction in that inflammation. So it's so cool. And it was Kylie and Ryan that shared this technology with me. I had used curcumin and turmeric, probably dozens of different versions over 20 years in practice. And I was a fan, but I just never seen it work that amazingly. And I know Sherry will agree with me. She's a naturopath who loves herbal remedies and has used lots of different things with turmeric and curcumin, but we've never seen anything that's worked like this. And so I'm super excited about it. Make sure that if you haven't tried this technology, or maybe you have somebody in your family that deals with autoimmune disease or chronic inflammatory conditions, just encourage you to get this in their hands.
Yes. Thank you again, Dr. Jeremy, for sharing with us tonight. And thank you, Kylie. And thank you, Carrie. I have to say, Carrie, she uses my login with her, and I looked up and I saw myself and I thought I had my camera on. I did a double take. So we do our power hours together and she uses my link. And I was like, there's two of me on here tonight. So it kind of got me going. So thank you for that moment of, it woke me up, Carrie. Thank you. So anyway, thank you all so much for coming on. Please, 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 I'll have this up and ready for you all to share by tomorrow morning. I promise I am back home. I don't have 4 grandkids running around, so I can do it promptly. I promise. And reach out to your friends and family. Share this information with you all. Somebody is praying for this solution. You need to share, okay? And next week, we're going to be talking on heart health. So start doing some little teaser posts, figure out who of your friends have issues with their heart, and not an ugly heart, a bad heart, okay? We're talking about issues such as, what are some of the issues that we should be listening for this week?
Yeah, we're going to talk about cardiovascular disease and, things like high blood pressure and heart attacks and strokes. And it's a huge, yeah.
All those things. So be listening, have your ears perked for those things this next week. So you can invite those friends to next week's meeting, or ask the doctor, whatever this is, a webinar. And those of you who are here, I'm sorry, my mind just went, I guess I need to take some more turmeric as some more nanofy. But if you're here, get back with the person who invited you. They loved you enough to share this with you. Get with them, get your bottle ordered, get your results started. And this product, it comes with a 30-day money-back guarantee. The only thing you stand to lose is your symptoms, and that's not a bad thing to lose. So you all take care, be blessed, have a wonderful night, and we will talk to you all soon.
Bye, guys.
Bye.